Hey, thank you so much, Shanella, for the introduction. So my name is Mohammed Al-Qudaimat. I'm a PhD candidate right now at the University of Toronto. I'm Canadian Jordanian. I'm from Jordan originally. But yeah, Canada, Jordan and Lebanon within the same region. So we share culture and we share language. So I shared my slide. I hope you can see my slide. Okay. So basically, I'm a co-chair of the SIOP Global Health Network, Traditional and Complementary Medicine Working Group, and a member of the SIOP Nursing Network Steering Group. And today, I'm going to talk about the use of traditional and complementary medicine in children with cancer. And based on my discussion with Shanella, that we need to make this like more like based on case studies and have this kind of clinical consideration and clinical thinking in a place in this discussion. So that's why I choose one of the published case studies so we can discuss it together. But I want to just make it very clear now before I get started that not all traditional and complementary medicine strategies are harmful. So we need to keep this in mind. But at the same time, we should also consider the safety and effectiveness of those traditional and complementary medicine and help patients and help children and their families to make informed, collaborative decision about using or not using traditional and complementary medicine. So I want to just make sure that you can see my slides. So just let me know by the chat or just say if you can see it.
Yeah, we can see them.
Okay, great. Thank you. So, this is a case study that was reported by a group of practitioners and researchers from Germany. And the title, as you can see, that severe cyanide poisoning from an alternative medicine treatment with amygdalin and apricot kernels in 4-year-old child. And when you read an article, you should read it critically and just make sure that you understand the information that the author. Sometimes there is some overlaps or maybe not a clear description or using not precise terminology or definitions. So keep this in your mind that in the title it says alternative medicine, but basically the patient was using complementary medicine. There was no abandonment of conventional treatments. So let me just describe the case. Now, as you can see on the slides, that this case is a 40-year-old boy with a history of metastatic ependymoma. Ependymoma is a brain tumor. And the child received standard oncology treatment in the local hospital in his area. And usually ependymoma, the child with ependymoma undergo surgery to resect, to remove the tumor, confirm the diagnosis under microscope, and then receive radiation. Some cases, chemotherapy depends on the protocol that the oncologist is following. And in this case, the child received the conventional treatments and received the cancer treatment. So what happened? The child suddenly collapsed and became unresponsive, and the family took him to the close ER, not the ER of the same hospital that the child received the cancer treatment or the brain tumor treatment. And so the child was agitated, unresponsive, and there was signs of encephalopathy with a glaucoma score of 3, low glaucoma scale. So initial blood gas analysis showed that the child has had severe metabolic lactic acidosis, as you can see from the figure, low pH, and as you can see, high serum glucose. So the healthcare team provided supportive intensive care treatments, fluid resuscitation, and oxygen administration. And because they asked the family about the diagnosis and they told them about the brain tumor, they did MRI and they confirmed that there is a tumor progression or cancer progression. So with further questioning or asking the patients and taking more history about what's going on, what happened, and because they did not really relate the metabolic lactic acidosis with the cancer, there is something happened other than that. So the family mentioned that because of the overall poor prognosis of the of cancer of brain tumor, and to improve the child's general condition, they consulted a general practitioner, and as they describe it in the article, that this general practitioner identified or describe himself as trained in complementary therapies. So the general practitioner, and again, we're talking about healthcare providers here who prescribed those kind of products to the patients. And this general practitioner recommended vitamin therapies as daily to be taken daily by the patients, as intravenous and oral preparations. And the patient was on this, as you can see here in this. This is the picture, the exact products that the patients consumed. And apparently, the patient was this over days or even weeks over those taking those kind of products, and I will describe them to you in a minute. But after the patient received the final dose of those products, the patient or the child suddenly collapsed and became unresponsive. So that was the main complaint, the chief complaint, that patient was brought to the ER. Now, the healthcare providers in the emergency department, they kept asking, and they tried to understand more what kind of things that the child received, and the family brought those products. So the patient was on what's so-called vitamin therapies, and there was unquantified amount of intravenous preparations. Basically like a bag including fluid that we don't know what are those fluids. There was no description on it, the dosage, the active substance, the details about those intravenous preparations was not really clear. Also, the patient was on oral vitamin B17. I'm not sure if you're familiar with this, but this is what they call it amygdalin, and there is a brand that you can find mostly online. It's called Novadalin, and the patient was like taking this 4 times a day. Like every time the patient took 500 milligrams per day. And if you go back and read more about amygdalin and see the dosage and let's say all the data, the available data is provided to adults. So, and one reference mentioned that the adult lethal dose, and you can find this in many articles. The lethal dose for adult is 0.5 to 3.5 milligram per kg. So basically, if you look at the dosage that the child took, it was really very high comparing to the lethal dose that the adult would take. Also, the patient was on oral apricot kernel. I put here picture just to show you the apricot kernel with the shell on and without the shell. So the patient, and as you can, this is similar to what you can see in the picture here, where the patient, the product that the patient consumed already. And I put here that the American sweet almond that we consume to see the difference between the two in terms of the shape and the texture. So basically, the patient was on took like 5 to 10 pieces of those apricot kernel. And if you go back to literature, also you can find that the recommended daily adult dose is like 1 to 2 pieces, not 5 to 10 pieces per day. And also the patient was on vitamins A, B, D, and E, and some minerals like selenium and sulfur powder. So this is the kind of the vitamin therapy that the family brought to the ER and mentioned to the and described to the healthcare providers that what happened and what the patient took. And they mentioned very clearly this was recommended by a general practitioner who defined himself as expert in complementary therapies. But why this is dangerous, or what happened to the child? So the first thing that the healthcare providers, and this is very important. So when you ask about traditional complementary medicine, you need to ask first about whether the child received any products or did any practices. And if the child received any products, the most important thing that you need to ask for is the bottles. As the healthcare team here ask for the bottles, they need more description, because most of the time families do not really have all the details, and they may not remember all the information. So when the family brought this to the ER, the ER doctor read, they needed, I don't know if you can read it, this is in German, but you can see the word cyanide here. There's something like warning here, and there's a word, there's something about cyanide toxicity. And the doctors, once they read this, right away they thought about toxicity and maybe cyanide toxicity. And that's why they did analysis like 2 hours after the last administration of what's so-called vitamin B17 preparations. And the diagnosis was confirmed with cyanide toxicity. The cyanide level was 515 microgram per liter. And as you can see in the same case report, they included the normal as less than 50 microgram per liter. The normal range, the normal score should be, or normal level should be less than 50 microgram per liter. And toxic range was more than, like, should be, if it's more than 200 microgram per liter, this is the same thing that what happened to the child, like 515. This is like toxic range, and lethal, it could be lethal if it's more than 3,000 microgram per liter. So once they understand the reason for the child symptoms, they right away, they give the child the antidote. And it's very important to ask, again, as I mentioned earlier, that you should, if you face such cases, you need to ask more questions. And maybe the most important part is asking for the bottles, and that include details. Sometimes it does not include details. Maybe you need to contact the practitioner, the general practitioner who prescribed that, in order to understand exactly what kind of active substances was there. But by the same time, this should be swift and fast, especially in case of the emergencies. So at the ER, they gave, after they confirmed the diagnosis, then they gave sodium thiosulfate, and the patient has been improved, or the patient improved, or the situation has been improved significantly after 2 hours. And there was no side effects of the sodium thiosulfate. So the patient was kept on observation for 3 days, and then transferred to the hospital where the child received the cancer treatment at the first place. Okay, so what is the amygdala? And also you can also read something about lateral. So amygdalin is a plant substance found in walnuts, as well as apricots and cherry seeds. There is a synthetic substance that prepared in lab, what we call man-made, which is the lateral. This is a synthetic substance. It's amygdalin, but it's synthetic, and it's prepared in the lab. So both amygdalin and lateral, when they are when the child or the patient consume them, when the body the processing of those substances in the body, it will convert and it will be changed to be cyanide. So basically, there is a mechanism in the body to process amygdalin and lateral, and eventually will have like high cyanide level in the bloodstream. So people take those, even some of them, they know that they are somehow dangerous, that I will mention that I will mention in a minute about the anti-cancer property. But also people, they don't think that they are harmful, as some people take it based on beliefs that amygdalin or lateral will improve their health, energy levels, like used as detoxic or to detoxify and cleansing the body, help them to live longer. So those kind of things that it's there in some cultural beliefs and some traditional kind of medicine that children and adults take to improve health, but also to help with some symptoms. So it's for the cancer, as a cancer, an anti-cancer property for the amygdalin. Some people have this assumption or this belief that the cyanide, they understand that amygdalin could be transformed to cyanide in the body, and this is maybe something like happens with the case study that the family read that on the bottle, or on the bottle of the amygdalin or the apricot seeds, but it was not alarming to them, because maybe this is based on their belief that the cyanide that is produced by those substances in the body would kill the cancer cells. This could be something that we need to dig in deeper and understand, maybe by qualitative research, or even by just sitting with the family and just have an open and non-judgmental discussion and understand exactly why they're using those substances. But at the same time, if we go back to evidence, those claims about the amygdalin and lateral that they are treating, they have some properties to treat cancer or to kill cancer cells. It's not really backed by research. It's not really, you can find this in just unreliable sources or just general websites that's not specialized and does not provide information based on evidence. And luckily, we have a recent systematic review by Cochrane about the lateral treatment for cancer. And keep in your mind, most of those substances, the research on most of those substances are done for adult populations, not for children. And but at the same time, we can learn. We know that kids are not small adults or little adults, but at the same time, the problem that we don't have that much source of knowledge and information about those substances. That's why we need also to learn from the adult literature. And as you can see, in this systematic review by Cochrane, it mentions very clearly that there is no reliable evidence that support any kind of effectiveness or any kind of positive effect of the amygdalin to cure cancer. And they mention very clearly here about it's very important for healthcare providers to mention this to the patients, to the child, to the families, in order to help them understand the consequences and the safety concerns about it. And they mentioned very clearly that the US FDA and the European Commission, they banned the use of amygdalin very clearly, but the problem that patients can access this, children and families that, I mean, basically family parents can access this through the internet, where there's no control of the government on, and they even can eat the natural, not the preparation as prepared as capsule or tablet. They can eat as I mentioned before, you can find it in the fruits, and they can consume it if they hear it from families or untrained general practitioners who would have that assumption that amygdalin would be anti-cancer. It has anti-cancer properties. So so this is very important to keep in mind. Now, the bigger question here, could we prevent what happened to this child? Could we prevent all of these kind of consequences of consuming amygdalin with this child? The child was in pain for sure, and the family took him to the ER. It was life-threatening as well situation. So simply, if healthcare providers simply start and initiate open and not judgmental discussion about the use of T&CM and help the patient understand consequences, then we can be proactive and we would avoid such case, such consequences for this case. So it's very important. And again, my message always when I discuss the T&CM use in children with cancer, that we can simply just be open with the family. I understand some families, they don't really disclose, they don't want to disclose, but if you go back to the literature, you can find that many studies talking about that one of the reasons, and it could be the main reason, that children and families fear doctors' reaction when about the use of T&CM, and that's why they don't bring it up. They don't really talk about it. But once having this open and safe environment for the children and the parents, they can be open and they can elaborate. And I always discuss this. So why this is important, why we need to have this joint meeting with nursing, why do I need to also to discuss this with doctors and pharmacists and other healthcare providers, because we know that the use of traditional and complementary medicine is high. It's very common among children with in children with cancer. So this is like it's global phenomenon. It's not just based on the region or the low income countries, high income countries, all the countries. It's everywhere. So there are many reasons for using T&CM, but it's common phenomenon. Regardless the reason, it's there, and we need to keep asking patients about those in order to prevent any consequences like the one that happened to the patients that I described earlier in the case report. Also, as we discussed before, and as I mentioned just in a minute, so there is low disclosure rates, and this is very obvious. In the recent systematic review, it shows that the disclosure rate is low in all countries, regardless the level of income, and whether it's a low and middle income countries or high income countries. Even high income countries, if you can see here that the percentage is a little bit higher, but still more than 50% of parents and children do not really disclose the use of traditional and complementary medicine to their healthcare team. And as I discussed earlier, lack of discussions in clinical settings, lack of having safe, let's say, safe zone for the child and the parent to express their feelings, to express their values and beliefs, their intention to use T&CM. Then, if we don't have that positive environment and safe environment, they will not discuss it. They will use it anyway, and we will end up having such incidents that, as the one that I described in the case report. So safety and effectiveness is something that we need to keep an eye on. As I mentioned earlier, that not all T&CM products and practices are dangerous. Some of them are very helpful. Some of them are safe, but we don't know about their effectiveness. But there are some types that they are not safe. We know they can make harm, and we know that they would harm the child. So that's why having this proactive approach of discussing this, discussing the use of T&CM with children with cancer yearly, once the child diagnosed with cancer, after like a few sessions, then you can bring this up. I mean, the healthcare team together, they can bring this up to the patient, to the families, and to the child, and discuss it and see whether they plan to use or not to use, and then have this kind of collaborative decision-making approach in order to help them to choose to use or not to use T&CM in order to avoid any potential side effects or interaction with the conventional treatments. I shared this in the last slide. This is the questionnaire that I adapted and validated as part of my PhD studies that would be helpful. It includes important questions based on or according to children with cancer, their parents, and healthcare providers. Those questions are like short list of a question, like for the child version, 13 items, and for the parent version, 15 items. Simple questionnaire to help healthcare providers collect some information to initiate discussion about the use of traditional and complementary medicine. So I included here the QR code if you like to have a look and maybe take benefit out of it in the clinical discussion with patients and families about T&CM. Okay, I need also to emphasize once again that we have wide variety of products and practices that are under the umbrella of complementary medicine. And complementary medicine it has a basic philosophy as treating patients as a whole, which is like we have like overlap with the fundamental nursing care. So as nurses, we providing care to the patient as a whole. It's not just a separate organ or body systems or disease. We look at the patient from different angles, and we need to look and provide the care accordingly, and provide the care as a whole person care, not just based on the disease. So that's why this is reflected very clearly with the variety of types of CHA or complementary therapies, complementary health approaches, or traditional complementary medicine. And as you can see that simply some of them are really very, very helpful kind of things, like the combination of nutritional and psychological, like mindful eating. If we have a trained personnel or trained professional who will help with mindful eating, that would be great, especially for certain situations. So keep this in your mind. We have wide variety of products and practices. Not all of them are harmful, but some of them could be, and that's why we need to keep this in our list of asking the patients about, and keep this on our radar. I also shared this slide in the last slide just to show you the overlap of fundamental nursing care, the thing that we learn in school, and the some of the basic principles of T&CM philosophy. As nurses, as I mentioned just before a few seconds, that we provide care as whole person care, not just based on disease or separate organs. So we're not treating separate, or like in the case study, like in the ependymoma or the brain tumor, we're not just looking at the tumor in the brain and just treating that tumor or the brain tissue. We are looking at the patient from social, emotional, physical, or spiritual. So this is part of our fundamental nursing care. This is what we learned. This is what we're doing. The other thing that we always talk about child family-centered care, and it's a model adapted by many hospitals, by many pediatric units. There is some evidence talking about the poor implementation of this kind of approach, but still it's part of the thing that we believe in and we worked toward, and we try to improve more and more, having this respect of cultural background and the informed decision making about informed decision making for healthcare, for the child healthcare. So the child and the family should be part of the team. So this is what we also as nurses learn, like at the first or second year of our nursing training. And evidence-based practice is something that we keep in our mind. So we apply the best evidence considering the clinical situation and circumstances, as well as patients and family values. So it's not about just implementing the evidence as it is. We need also to make sure that the patient, this is not against their values, and the child and the family would use what we recommend to them. And maybe we can provide them with some options if this is like the thing that we recommend against their values. So those kind of the nursing fundamentals, it has like overlap with the T&CM philosophy as a whole person care. It's the philosophy of T&CM and patient's background, cultural background, respecting that, because most maybe traditional medicine coming from the cultural background. So I put this diamond because I like it. Like to show how nurses would be would play a key role in T&CM informed decision making by the family, and helping them to provide to come up with like the safest decision about using or not using T&CM based on the child's situation, and also what we know from previous research on some types of products and practices of T&CM. Okay, so the big question here as a nurse, what's your role? And again, I summarize this in this acronym, which is LEAD. I put it as LEAD because I do believe nurses can lead here. We are at the center of healthcare. We talk with the doctors, with the pharmacists, with the other healthcare professionals, and also we have more like exposure and also more whole person view to the patients, and discussing with the child and the families their concerns and their health values and beliefs. And that's why we can play a key role here. And at the end of the day, we are advocating for the child health, for the child safety. It's patient safety, the child safety. So that's why we should like play a role. I know nurses like handling too many things in the clinical area. I totally understand. I'm a nurse. I know what the burden of nurses. But at the same time, T&CM could be a serious thing when it comes to some products that could be harmful to the patients. And that's why we need to think about it and maybe discuss it with the nurse leaders, nurse managers, with the doctors, oncologists, pharmacists, in a way or another, how we can improve the culture of discussion about T&CM, how we can not having judgmental discussion, how we can have an open discussion. Maybe the burden could be distributed, but at the same time, maybe the nurse could be the starter. So as a lead, L is for learn about T&CM use, It's very important to learn about it. So if you don't know that amygdalin would be like cyanide inside the body and could be ultimately will be like having cyanide toxicity, then you will not understand what happened to the patients based on the case study that we discussed. So learn about T&CM use in children with cancer, not just on those. Yeah, you can focus on those kind of things that we know that they are harmful, but also on the good things or on the good strategies, on the not good, let's say, safe and effective strategies. Like in recent studies about acupuncture for chemotherapy-induced nausea and vomiting, there are interventional studies were conducted and have positive findings about the effectiveness and safety of the acupuncture acupuncture for chemotherapy-induced nausea and vomiting. Also for listen actively, and again, this is part of it. It's part of the non-judgmental discussion and try. So in the case study, maybe if the healthcare providers just ask simple questions. So what did the child take at home? They will mention he took some nutritional supplements, and then the healthcare provider do not really elaborate more and just okay, nutritional supplement, and just write nutritional supplement and just overlook what was the source of the problem. So listen actively to patients and elaborate more, and ask more question and try to understand what happened. And this is again this is part of our training, I understand, but sometimes we could underestimate the use of T&CM and maybe avoid, as documented in previous research, that maybe healthcare providers, mainly doctors, avoid discussing T&CM for several reasons. But listen activity is very important. For ensure that the patient has access to authenticated source of information. And this is maybe linked to the learn. So if you learn from authenticated source of information, then you can also recommend some sources which is like directed toward patients and families to the patient. So make sure that the child or the family receive this information from the trustworthy source. For advocate for open non-judgmental discussion, and as mentioned before, nurses can play really key role here and keep bringing this up in the clinical area, and discuss this with your team and try your best to ask, and then for documents. So once you ask, it's very, very important. It's very crucial to document what the patient is receiving or doing, like specifically for the substances or the products, the reason of use, the dosage, the frequency, and outcome. And ask, as I mentioned in the case report, that we need to ask for the bottles, because most of the time families and children do not really know exactly what kind of things that the child was received or the child received. Another set of actions that you can also use, and again, I put it here in acronym as TIER. So the first thing is take action in situations where patient safety is compromised. Again, the same actions that we learned in the school or what we practice right now. If we have like any reaction from any medication, the first thing that we stop the medication and then report it and try to see the source of the problem. And sometimes, so patients would have symptoms that is not really severe for a few weeks, but without having clear management, because we don't know exactly the source. So that's why, again, the key action here is to have that open and non-judgmental discussion in order to learn more about the source of the problem. But once you have once you notice this, once you observe this, take action. E for explore patient's understanding of T&CM. And this, again, this is something that you would document, as I mentioned in the previous slide, but also understanding the reason of use would help us also understand from where the patient, from where the child of the family came from, and why they're using it. Is it based on beliefs, which is something that it could be difficult to change, but we need to work on it. If it's harmful, for sure. If it's safe, not harmful, for sure. We cannot discourage. But if it's, again, if it's not safe, we need to know why they're using it. Do they use it to cure cancer, or this is just supplementary or complementary to the cancer treatment? So in the case study, in the title, they mentioned alternative medicine, which does not, it's not consistent with what the details in the article. In the details in the article, the child underwent the conventional cancer treatment, and the child took all the cancer treatment, but also they wanted, the family, and in this case, the child is 4-year-old. So the family wanted the child to be more active, help with the child well-being, but at the same time, apparently they have some targets to cure cancer, maybe, but this was not mentioned in the article very clearly. Apparently, the healthcare providers did not really elaborate and dig in deep to understand why they use, but it mentioned that this vitamin therapies, what they call vitamin therapy, was used to help with the cancer. So apparently, maybe they have some kind of beliefs that the cyanide that will be generated or produced from the amygdala would kill cancer cells, but apparently they do not have clear idea if the child will have like this cyanide poisoning. And A, advocate for policy and procedure for T&CM use. Try to maybe discuss this with your team, and you could have guidelines to regulate the discussion about T&CM use in a clinical practice, and also maybe come up with symbol based on your region, symbol decision aid. I know this takes time, but maybe you can start symbol by having symbol fact sheet. We at the Traditional and Complementary Medicine Working Group, right now we're working on the project to have this fact sheets based on the WHO region, but this will take some time to complete it and make it in a shape that is verified, and going back to all the literature that we can reach and come up with that fact sheet. But maybe symbol policy you can make, as I always share this 2x2 table, that you can have this in a clinical area. It does not need to be policy or a procedure, but maybe a guideline to guide the discussion about T&CM use in the clinical practice. So you can just have this 2x2 table and educate nursing staff and medical staff on how to use it. So if T&CM, we know that it's safe and effective, then there's no problem to recommend and keep the child and let the child and the family use and try. But and if it's safe and not effective, or we don't know about if it's effectiveness, then we can tolerate. Still, it's not harmful. But the problem here, when it's not safe. But if it's not safe and we know it's effective, then monitor closely or discourage. This depends on your clinical and the team. I mean, you can make this as a team. You can decide about it and then discuss it with the patient as a team, or the team can discourage if it's not safe, not effective. So those kind of things, you can come up with simple clinical guidelines to help you and regulate how you discuss T&CM with children and their parents or families. And lastly, refrain administrating the treatment if no limit or limited information is available. And again, this is very fundamental nursing care, and this is very fundamental medical care that we always learn in school and also remind each other. It's very simple, very fundamental, very basic, that we will not administer. This is very important. Why? Because some general practitioners, like in the one in the case report that I discussed in this session, they prescribe that person prescribed IV preparations, collection of vitamins, but there was no label. No, we don't know about the active substance. We don't know about the amount. We don't know about the dosage. So if the families or the patient ask you to administer this IV professionals who can have IV access and provide this IV preparation, then be cautious. I understand it's part of our fundamental care, but I'm just here to remind myself and everyone that this is something that we can, this is like a situation that we would face, and that's why we need to keep this in our mind, that we cannot, we should refrain administering any treatment that we don't know about or we know nothing about. So again, I will just pause this for a few seconds if you want to take a picture, but it's free. It's available in this free paper. So the paper, this paper is very interesting paper talking about the use of complementary medicine, or they call it, or integrative medicine. They call it as integrative medicine in pediatric in general. But it has very interesting and excellent description on how the healthcare providers would approach T&CM and how would approach a patient asking about T&CM, and how to help patients come up with active collaborative decision with an eye on the with an eye on patient safety. Okay, so this is everything. So I thought to keep like 15 minutes for Q&A. So I will hand it over to you, Shanila.
Thank you, Mohammed. It was a very interesting presentation, and I just want to add that nurses need to build up onto their knowledge about T&CM and be open and respectful of the patient's choices and involve them in the care. And it was a very interesting presentation, a lot of new things to learn about. If anyone has any questions, please feel free to open up your mic and ask the question. Mohammed, can you please share the link to the article that you were mentioning, probably in the WhatsApp group or here in the chat box, so that anyone who's interested in reading this article can have access and read through it?
Yes, for sure.
Thank you. It was a very interesting presentation. I do not see any hands raised for any questions, but Mohammed is always available and very interested in answering and addressing the questions if you have any. So if anyone wants to approach him, I think they can really talk to you on messages or WhatsApp or just have an email. And
yeah, Shanella, I want to add
from our side. Yeah,
I want to add something here that so if you're interested to learn more or to be part of traditional and complementary medicine working group, please let me know. We're meeting every Wednesday or every last Wednesday of each month at 10 a.m. EST. So it's every last Wednesday at 10 a.m. EST. And you are more than welcome to be part of our group. So we're looking for more and more interested, brilliant practitioners and researchers in this topic as we are expanding our projects. So just let me know, and you are more than welcome to be part of the team.
Thank you so much. If we don't have any questions, then I would like to thank you all for joining us for this joint session. And I hope you learned something new and interesting. Till then, we will meet next month, hopefully, with something new for you guys. Thank you for joining.